Fox 56 News Chief Medical Contributor Dr. Ryan Stanton is with us in studio.
This segment, he's continuing his discussion of the emergency department.
Yeah, this is really all about access. And no matter where you live, do you have access to the highest quality emergency care? And so we're going to work on that a little bit. And so when you see this red sign, the expectation is simple. If you have an emergency, a physician will be there in person to care for you. But many Kentuckians may be surprised to learn that in some hospitals, especially in rural areas, there may not even be a doctor physically on property. That could soon change. New legislation filed in Frankfort aims to ensure that every emergency department in Kentucky has in-person physician coverage 24 hours a day, 365 days a year. Currently in a few hospitals, if a physician is not present, care may be delivered solely by a physician assistant or nurse practitioners, often with remote physician oversight. Recruiting doctors can be very difficult in rural areas, but emergencies don't adjust based on their staffing levels. Emergency medicine spans the full breadth of care, from minor illnesses to life-threatening conditions and complex procedures that simply cannot be managed remotely. Physician assistants and nurse practitioners are essential, highly valued members of the physician-led team and play a critical role in access, but they are intended to work as an integral part of the physician-led team, not replace it. The goal of this legislation is straightforward. Every resident and visitor to the Commonwealth should have access to physician-led emergency care, regardless of the zip code. Similar laws have already been passed in Indiana, Virginia, and South Carolina without emergency departments closing or disruptions in care, proving that access and quality can go hand in hand. So this one's very important legislation because we're seeing this growth that no matter where you live, even in rural areas throughout the state, you should have access to physician-led based care because emergency medicine and the care that's provided in emergency departments is getting more and more advanced every single year. What started 55, 60 years ago as a room for consultants to come down and see their patients is now its very own specialty with highly trained physicians and staff in there. So we want to spread that out and make that accessible. I'll be in Washington, D.C. Friday at the White House regarding a meeting with investment in rural care, and that's the key here, is getting investment into rural care so people can get the care in the communities in which they live.
You know who you're going to meet with at the White House?
Don't know at this point who's going to be there. Got the official invite yesterday, so it was pretty fantastic, pretty excited about it. Second time I'm going to get to go to the White House, and hopefully we can help improve and advocate for care here in Kentucky.
And then hopefully you can recap and share with us what you accomplished there.
We'll see what happens.
All right, Doc, thanks so much.